Good morning, everyone. Good morning to you all and to those here in the TSK room and those online on Zoom. Thank you for being here. This is Morning Forum. My name is Bruce. I'm a member of the Human Rights Working Group, which is led by Dolores Halbrin and Jeff Peckrell. Jeff is out of town. And the third person that is the leadership of that group is Melvin, who also brought us our breakfast this morning. So we will be introducing our speakers. We have a really interesting and important program this morning on an issue that is relevant to everyone and more relevant in some ways than ever around healthcare in this country and the right to everyone to have healthcare. But first, I'm going to read some announcements, and then we'll have the Ohlone prayer. First announcement is that today after forum, well, actually after the service today at 1 o'clock, in the chapel room, there's going to be the blessing of the animals. And that's a yearly event, takes place around this time every year. On October 17, which is Friday night, in the Foz room at 6:30, there's going to be a meeting to talk about No King's Day, which is the following day, October 18. A super important day for us here in this country in facing this fascist regime that we're up against. So I encourage everyone to go to that meeting in the Foz room at 6:30. It's going to be led by Greg Stevens. And of course, on the 18th is No King's Day, which is going to be at 2 o'clock in the afternoon at the Embarcadero. That's where people are meeting. At night on the 18th, there's going to be a play written by one of the members of this community, Bruce Clemens. The play is called Hansel versus Gretel, not Hansel and Gretel. And it's Hansel and Gretel as 80-year-olds. I guess they're arguing about what happened back in the day or something like that. And it's going to be interesting. The play itself, I think, will be interesting. And then the following morning on the 19th, right here, next Sunday at 9:30, there's going to be a follow-up to that. And the follow-up is the audience, those who either are interested in the conversation or actually went to the play and saw it, to come and talk about the relevance of the play to their lives. So that's going to be here at 9:30 to next week at this hour, right here in the TSK room. Then on Saturday, October 25th, in other words, 2 weeks from yesterday, there's Immigrant Recognition Festival, a joyous resistance market. That's going to be taking place across the street at St. Mark's, where there'll be vendors, mainly from the mission. There's going to be 15 vendors with food and jewelry and crafts and that sort of thing. It really, in a way, is an event to help them, or that's one aspect of the event, is to help them, because situation facing the immigrant community is, as you all know, is very dire, and there's a lot of economic difficulties. So there'll be the recognition festival will be music, food, workshops. There'll be children's activities, storytelling, and more. And if any of you have children's books, we would like to have a place where children who come, we're encouraging kids to come, can get free children's books. If anybody has any access to or has children's books they'd like to give away, you can talk to me about that. And that's going to take place from 11 to 5 p.m. at St. Mark's on Saturday, October 25th. And then the last thing I'm going to mention is November 5th, there are people organizing across the country for a massing in DC to drive out the Trump regime. And there's flyers, and Ann has flyers here. Or do you want to make it? Do you want to talk about it? Come on, you can go up here. Go ahead.
I just encourage everybody to pay attention to these flyers that I'm going to be handing out. And I am actually, this is not Unitarian Church, this is me collecting money so that we can get people to go to Washington, D.C. on November 5th and try and stay very present in mass nonviolent protest until this regime, which is cracking, will fall.
It's an ambitious, but I think very necessary movement that we need to support. So those are I just want to make, I didn't write that. I do want to make a point, and that is at this time in our history, we're seeing a lot of people who are acting very heroically. And some people that came to mind, Jane Fonda, Jimmy Kimmel, J.D. Pritzker, the governor of Illinois, Brandon Johnson, the mayor of Chicago, and there's many, many, many more like them. But there are also people that in organizations that are showing just the opposite, cowardice and capitulation. So I think what we want to do in this church is we want to be on the side of those who are standing up against oppression, against the Niagara Fall of lies that this regime is pushing out there, and stands in defense of our immigrant brothers and sisters and all those who are coming under attack by this regime. Okay, so with that, I'm going to ask Dolores to come up here, and she's going to do the Ohlone prayer.
Good morning, everybody. We, the members of the First Unitarian Universalist Society of San Francisco, acknowledge that our community is located on the unceded ancestral homeland of the Ramaytush Ohlone tribes, the original inhabitants of the San Francisco Peninsula. We recognize that we benefit from living and working here, and we affirm their sovereign rights as First Peoples. The Greater Bay Area is also the ancestral territory of the Miwok, Yokuts, Patwin, and other tribes. As the original stewards of this land, the indigenous peoples maintained harmony with all things, all nature, and for millennia. We honor them now for their enduring commitment to our Mother Earth. Thank you.
Okay, thank you, Dolores. And now I'm going to introduce our guests on our program this morning. I just want to say that the Physicians Organizing Committee is my understanding been around for quite a while, and I know they've been here before, and I don't think I have to tell anybody the importance of this initiative that they are promoting and that they are championing here. But after our guests speak, there'll be a Q&A, as you know, and there should be cards around. If they're not, I'll get some where you can write down your comments and questions, and we'll have an opportunity to engage with our guests on the issues they're raising. So the Physicians Organizing Committee is an all-volunteer medical advocacy group that works with doctors to fight for a healthcare system based on patient care instead of profit. What a concept, huh? They focus on fighting insurance denials, budget cuts, and the closure of essential services by organizing doctors together with the community they serve, with the goal of building a healthcare system where doctors can actually serve their patients, not the bottom line. The Physicians Organizing Committee will be discussing some of these current issues they are fighting in the healthcare system, past victories like stopping the closure of the stroke, STEMI, I'm not sure they'll explain what that is, and trauma department, I see, the trauma department at the East San Jose Hospital. Current fights like the corporate takeover and subsequent understaffing in Fresno and and what you all can do to help. So we're fortunate to have Sydney Ragsdale. And I think Sydney, you can maybe talk a little bit about yourself and your background. And also Naveen Reddy is here he's a neurologist at UCSF. Thank you, both of you, for coming. They can talk a little more about themselves. You can ask questions about them. So with that, I'm just going to ask them to come up here and thank you so much for being here to do this.
Yeah, so I'm Sid. I'm a volunteer with the Physicians Organizing Committee. I've been volunteering with them for about 5 years now, almost 5 years next month. My mom is actually here, but I went to the UU Church down in Monterey when I was growing up, and so she was able to get me a connection through the minister there up here to get to talk to all you guys about all the crazy stuff that's going on right now, because I know this church is one that is very concerned about the pressing issues of the day, and healthcare being a major one of those. Yeah, I'll let Dr. Reddy introduce himself as well.
Hi, everybody. I'm Naveen Reddy. I am a doctor at UCSF, a neurologist, and also at the SFVA. I've been part of this organization for about a year and a half, and I'll tell you guys a little bit more about what I'm doing with the organization.
Yeah. So, like Bruce said, we are all volunteer advocacy group, working with doctors to fight all the different issues that stop them from getting their patients' care. Because if any of you have, ever known doctors or had, kids who are going into medical school or friends of kids who are going into medical school, it's a lot of work to become a doctor, right? They do all this studying, all this training and stuff like that to know what people actually need when they get sick. And then, they actually get into the profession itself and they're told by, maybe somebody with an MBA and a suit and tie what they can and can't get for their patients based on what is going to make the hospital or the insurance company money, right? Rather than what's actually going to take care of people. And I don't think I need to tell you guys too much about all the different problems in the healthcare system, but obviously we have the most expensive healthcare system in the world, clocks in at $5 trillion a year now, double what basically any other country pays. And yet we have the worst health outcomes of like any advanced industrial country, lowest average life expectancy, highest rates of heart disease and diabetes, infant and maternal mortality. So we spend a lot more money, but we're getting a lot less healthcare than any other country. And this is mainly because of the for-profit nature of our healthcare system, which really opens the door for profiteering, Nearly 80% of doctors now are employed rather than working in like private practice or being, more independent, which means that their medical decision making is put under, some kind of corporation. Private equity is coming in a lot more. And so again, that means that they are not in complete control of their own medical decision making. And so, Physicians Organizing Committee was formed in 1982. Like it says, 43 years. We actually just celebrated our 43rd anniversary dinner last night. So if I'm a little tired, I apologize. I was cleaning stuff up. But Dr. Reddy here was our MC, so he'll tell you a little bit more about that and some of the stuff he was talking about there later. But we started in 1982, partially out of the strike of the San Francisco Intern and Resident Association at San Francisco General Hospital. The doctors there did a strike for better patient care. A lot of the stuff was things that other hospitals would take for granted, like enough, x-rays and translators, just to be able to communicate with the patients they were seeing and things like that. And they actually won the strike, but then they got into a nice long legal battle with the city over whether they were actually employees or whether they were students, because they're residents and the city was arguing that they were getting training, so they weren't actually employees and didn't have, bargaining rights. And so through that lawsuit, they lost a lot of the community support and the momentum that they had built up. And so they wanted to form a more permanent organization that could take these kinds of problems on, kind of outside of the labor laws and things like that limit a lot of the organizing and stuff like that unions can do with like the more broad community outside of just collective bargaining. And so, we work with doctors from all different kinds of specialties. Any of them are able to come to us with these kinds of problems that they're dealing with. We built a program to organize physicians based on, them being able to get their patients that good care. So all of our members are able to request and receive benefits. They come in two different forms. The first one is we call like level 1 benefits. These are smaller, involve one doctor, one patient. We've shown doctors how to get, brain surgeries or chemo for patients that refuse those treatments, organize lawyers to donate their legal expertise on everything from employment, medical staff law to the, pretty complex laws around mental health care delivery. We also provide advice and advocacy for physicians that are faced with retaliation, like one doctor that we're working with right now over at UCSF. He was basically is having his job threatened right now for calling out the fact that UCSF was double booking surgeons on surgeries. So one surgeon was scheduled to do two surgeries at the same time, which, can't really be in two places at once. So interns and residents are doing the surgeries unsupervised, which is not supposed to be happening. But UCSF could bill for both of those surgeries at the same time and make double the money. And of course, this is very dangerous for the patients, but you're in surgery, you're under anesthesia. They don't really know what's going on. And so when our doctor called out this practice, UCSF started going after his medical license. This is still a ongoing case, but it's a stark example of, the kinds of things that doctors are up against when they do, fight for care for their patients. And then the second type of campaign is more long term, involves a lot of doctors, a lot of resources, a lot of time, getting the whole community organized. And these all different cases. I'll go through a couple examples of some of our past campaigns, but they all share the same purpose, right? Which is teaching doctors how to fight and win battles on behalf of their patients and change those policies that prevented them from providing that care in the first place. So, I think I have some pictures a little bit further on of some of the campaigns we've been involved in, but, we, through massive community mobilizations, we were able to help stop the planned closures of both St. Luke's Hospital over in the Mission District, and San Leandro Hospital out in the East Bay. And both of those came about by getting the local government to begin to threaten Sutter Health's nonprofit tax status, which Sutter Health is still considered a nonprofit, even though they try and close hospitals down when they're not making enough money, which doesn't make a whole lot of sense. But Sutter Health gets about, just here in San Francisco, gets about $100 million worth of tax breaks every year, which they're supposed to provide a commensurate amount of charity care to the community, which they don't super do, but that's, that's what they do. But so we were able to get the local governments to start looking into that nonprofit status, which got Sutter to back off and agree to keep those hospitals open. Part of fighting to keep St. Luke's Hospital open is they wanted to build the one that's right across the street. And so the city eventually came in and said, okay, if you want to build that one, you have to keep St. Luke's open. And so they did have to rebuild St. Luke's and add the floors and the extra beds and things like that to make sure that those services were still available for people in the Mission District. We then worked with doctors down in Tulare, California, in the Central Valley, to stop an unscrupulous hospital management company from stealing millions of dollars from the healthcare district board there. The local healthcare district board had basically hired this guy. They were paying him like $3 million or something to run the hospital, and he was selling the medical equipment to other companies he owned, all kinds of shady stuff. So we're able to organize the doctors there to run a recall election of the local district board and get people elected to it to end that guy's contract, get in a new operator and keep that hospital open long term. It's still in operation. Another one was up in Crescent City. Again, Sutter Health. They really are in Northern California. They've got a pretty tight hold. But they wanted to cut Sutter Coast Hospital up there in Crescent City in half, from 49 to 25 beds, in order to qualify for what's called critical access status. If you guys have heard about this, it's been in the news a little bit recently because the funding cuts that are going on, they're threatening a lot of hospitals' critical access status, which is rural hospitals that don't have a lot of beds, a lot of patients and stuff like that, right? They have a hard time staying open because of the low reimbursement rates. And so the way that they try and mitigate that a little bit is by giving these hospitals like triple Medicaid reimbursement. And so Sutter said, we have a hospital that meets the criteria for the length that it is away from another hospital, but it's too many beds. So what if we just get rid of half of the beds, and then we'll qualify for critical access status so we can make more money? Never mind the fact that, probably about 150 patients a year would have had to take a helicopter over the mountains into Oregon to get that care that they needed, if they had cut those beds. And so we were able to help organize the doctors in the community there, do rallies, go to, different parts of the community. One of the people whose husband had donated the land that the hospital was sitting on threatened to sue the hospital, and the whole community was really active in against the hospital, being cut. And so we were able to again get Sutter to back off and keep those beds at that hospital. So those are some of the different historic things we've been working on over. Let's see, that's probably over the last 20 or so years. But more recently, down in Seton Medical Center in Daly City, that was threatened with closure back in 2020. Do you guys know Seton? Okay, hi. Okay, Mom, sit down. Apologies if people can't understand me if I'm going too fast. But there's a lot of good stuff. But yeah, Seton Hospital down in Daly City. Does everybody know that hospital down there? Yeah. The owner and operator of that hospital was shoot, what was it called? It used to be Catholic, but they sold it to not Apollo. Apollo's who owns it now. Anyway, they sold it to Verity Health. There we go. Sorry about that. Verity Health, which was backed by a venture capital group. And so they weren't making as much money off the hospital as they wanted to, and decided that they wanted to sell the hospital. And then nobody really wanted to buy it from them. So they decided to declare bankruptcy and shut the whole hospital down. And so our doctors were not going to let the only hospital in Daly City shut down. So we showed them how to organize together with the nurses unions and the service workers at the hospital, go to the board of supervisors in the state, and got them to put up enough money to keep the hospital open until we could get a new buyer in to run the facility. And that one is open as well. They were going to close it in like February of 2020, right before the pandemic was going to get started, which would have been a tough time to lose a whole hospital, especially the only hospital in Daly City. And then we also worked during COVID with the same doctors up in Crescent City. Some of them were working in the prison up there, Pelican Bay, which the California state government had basically said you can't transfer prisoners, between prisons during COVID, especially without proper testing and tracing and stuff like that, because obviously, right? It's just like a prison. I mean, we also what happened at San Quentin, right? It's basically a giant petri dish for these kinds of diseases and stuff like that, because of the conditions they force these people to live in. And so the doctors were seeing patients coming in and they weren't getting tested and stuff like that. And we were able to get their eyewitness accounts to another member who's a lawyer who was actively suing the state over overcrowding in prisons. And that pressure forced the Department of Corrections to actually take the government's mandate seriously and stop transferring inmates and actually doing the testing and the isolating and stuff like that. And to this point, I think Pelican Bay has not had a single COVID death. I think they've had a couple cases, but they didn't have any deaths. And like I said, the hospital up there, which was the same one that we worked with the doctors to stop from getting cut in half, it's only got 49 beds. So if you have an outbreak at this prison, that's going to overwhelm the entire local healthcare system, right? At least, here in the Bay Area, we have a lot more hospitals, a lot more beds, a little bit more resources and stuff like that. But up there, it would have completely overwhelmed their facilities and stuff like that. So that's kind of some of the work that we were doing during COVID. And then more recently, we worked with doctors up at Laguna Honda Hospital to fight the closure there. CMS came in and basically tried to tell them that they had to empty the facility, which if any of you guys know much about like nursing homes and stuff like that, there's something called transfer trauma, which is people that are transferred out of nursing homes, right? They're obviously, they're in a nursing home. They're not the most medically stable. About 25% of them will die within a month just from being transferred. No extra stuff. And CMS ordered the hospital to empty out like 700 patients. So that would have killed 150 people probably just based on the numbers. And so we helped the doctors there fight the administration and fight CMS. And basically got them to put a temporary pause that they got extended over the next couple of years until they were able to fix the problems that CMS had found and keep those patients at Laguna Honda and open it back up to new patients more recently. And then this past year in 2024, we also worked with doctors down in San Jose to reopen. This is what Bruce was mentioning in the opener, but the trauma, STEMI, and stroke services. STEMI stands for ST elevated myocardial infarction, which is basically just a very serious form of heart attack that requires very rapid intervention. You have to go into the cath lab pretty much immediately. And so the fact that this is the only hospital in East San Jose, patients would have had to go, 20 to 40 extra minutes to get these services. You're having a heart attack or a stroke or even getting a bad car accident. Those minutes really matter. And so our doctors there, united with a lot of the patient advocacy groups. There are a lot of really militant, Latino patient advocacy groups down there that really fought hard and got the local government to basically force HCA. The owner of the hospital was HCA, which is the biggest for-profit hospital corporation in the country, to sell the hospital back to the county for like way below market rate. I think it was like $150 million for the hospital and the medical office buildings. And so then now it's part of the Santa Clara County public health system, and they've reopened all those services as well as restoring labor and delivery, which is a really important one that has been closing at hospitals all over California, and causing a lot of problems for people. But so those are some of the more recent things that we've been working on, and I'll let Dr. Reddy talk about some of our current campaigns, especially fighting a lot of the crazy funding cuts that are happening right now in healthcare, particularly with some doctors over at the VA.
Thank you, Sid. Before I talk about what's going on at the VA, I just want to kind of talk a little bit about why I joined this organization and why I continue to work with it. So, I finished my medical school in 2020 and was deployed right to the front lines of the COVID pandemic in Baltimore. And that was quite a disturbing, but also radicalizing experience. My intern year was first day, second wave COVID. And, it really showed me how fundamentally broken our healthcare system is. Um, I saw that we didn't have any real central decision-making authority that could allocate ventilators or certain drugs or medications to hospitals. And so people were dying left and right because they didn't have access to ventilators or certain medications. I saw patients that didn't have health insurance, and their chronic medical conditions were uncontrolled. And then COVID comes and just decimated their bodies. And then a lot of vaccine hesitancy because of people's distrust in the medical system, because of corporate capture of our healthcare system. And yeah, that definitely radicalized me. And I think every resident in training comes to a fork in the road where they realize that the system is broken and you have to decide what you want to do about it. Do you just join it, try to maximize earning potential and just kind of put your head down and, put money into your Roth IRA and just make your money? Or do you try to do something and change the healthcare system? And I think both paths have their positives and negatives, but, I really tried, I decided to take the latter. So, I came to UCSF. I was a health policy fellow here, so I worked a lot in Medicare, Medicaid, learned a lot about healthcare subsidies and kind of these big abstract concepts. But I really also wanted to make some kind of impact in my community in San Francisco and the Bay Area. So this was about a year and a half ago. I was getting groceries at Andronico's in the Sunset where I live, and I saw this booth and it said Physician Organizing Committee. And I was like, okay, I'm a physician. I would love to get organized. And I met David and Sid there as well. And David's our main organizer. And I asked David, what's the purpose of this organization? And he said it's to fight back against corporations from affecting medical decision making. And that really resonated with me because I think that's the fundamental issue here in this country with healthcare. So I joined the organization and yeah, I've really been working with them since then. And, I think there's two main reasons why I continue to be in this organization. I think the first one is that there really is like a ideological purity to the folks that work in this organization. Everything from, the housing that Sid and David and Jeff live in, from the car that they that they drove here in, to the clothes on their back. Clothes on their backs. It's all donated. They don't have any salaries, don't have any wages. It's all donated from the community, and that's just impressive the amount of sacrifice that requires. But also it's it just shows me how dedicated they are to this cause. So all the money that's given into the organization, it really is fundamentally put back into helping physicians, which I think is great. I think the second thing is, there's, I'm a young physician, and there's a lot of tension in my life, from kind of what I was saying before, in the sense of, there's a part of me that's, be a good young immigrant doctor from India that was, raised in India and came here and was raised here, and, make your money and make your parents proud and, get a family and do all these things. And I still believe in all those things. But there's this other side to me where, I see that we as doctors have such an influence in our community, and we can't, I think sometimes we underestimate that influence, with our patients and the people that we talk to on a day-to-day basis. Um, and I think the people in the POC, they believe in me and they believe in doctors when we don't really believe in ourselves sometimes. And in a way, they are my moral compass. And I think that is their fundamental role in my life. And I'm really grateful that they provide that role for me. Um, and so, I'm a VA doctor. I run the memory disorders unit at the VA. And we're seeing a lot of funding cuts and a lot of doctors being fired because they want to save money. Another, interest, a small example, but I think something that really um, illustrates what's going on at the VA is, so our VA in San Francisco has a huge encatchment area, right? It goes all the way up to Eureka. So we have a lot of folks in rural communities, and if they need to come down for an appointment, they can do telehealth, but sometimes you need to be in person for some kind of procedure. And there is a van, that takes folks from Santa Rosa to our VA, and it leaves twice a day. And that's pretty much the only way a lot of veterans could come to our facility. And back in the early days of this administration with Doge, they fired a ton of people, and a couple of those people that they fired were the van drivers, right? So that van that takes people from Santa Rosa to our VA was pretty much canceled. It stopped transporting patients to our VA. And instead, what happened? They told these patients that, oh, if you need to come down to San Francisco, we'll give you, you can call an Uber. You call an Uber, and that Uber is around $200 one way to go from Santa Rosa to RVA. So when you're talking about, waste and fraud, that's money the VA and the government is providing directly to Uber instead of paying these van drivers and these VA employees, a good wage, a good salary. Um, and that's such it's a small example, but I think it really illustrates how, how I don't know, how corrupt, and how just inefficient this administration is. And Yeah, I'm grateful that you guys are listening to this, and I really hope that in some capacity you can volunteer, or donate anything you guys would like, to our organization. Thank you. I'll give it over to Angus. Yeah.
Right. And yeah, as Dr. Reddy was saying, we're out here trying to get new volunteers. We need all the help we can get. If you do decide to come volunteer with us, come help out. We're doing a variety of work. I'm a volunteer here. I do a lot of the publications work and the coordinating the specs like this one. But if you come in, we have benefit advocacy sessions, Monday, Wednesday, Friday, 10 a.m., where you can come in and start learning about what the doctors like Dr. Reddy are facing, what our members need help with in the system, and start working to fight that. Like recently, I worked on a case, the Markinson's case, where there was the lady that got two hand surgeries and she couldn't. They got prior authorizations from UHC, and which means, of course, the insurance company says, "Yeah, we'll pay for this. We'll pay for this via this procedure." And then they went back on it, didn't pay a cent to the doctor. And so we fought that. We fought that for years. We have actually got one of the hand surgeries paid for, but that's just one of like I think over 1,000, right? Individual cases we've overturned. Yeah. And so, yeah, we also do publications. So I don't know if we have yeah, we have our new diagnosis on us right here. This is our news journal that we write. All volunteer labor. We do all the research for the articles, all the design work, article writing. We get all our printing donated. So if you volunteer with us, you can work on this news journal. We most recently made our fall one this month. I worked on a couple of the articles. A lot of our volunteers have. But yeah, we need all the people we can get to learn the organizing skills necessary to fight back against these insurance companies, these corporations that are trying to, prevent good doctors like Dr. Reddy from making the decisions they need to make to help their patients because the companies are only in it for the profit. And yeah, and Yeah. I mean, yeah, we need all the help we can get. Any time you can give is much appreciated. We're in the office 7 days a week, often till very late at night, like 9, 10 p.m. So really, yeah, whatever you can give is much appreciated. We'd love to see some new faces in the office. And yeah.
And then, yeah, I know wanted to have some time for questions, right? I think that's the main stuff that we had prepared. But yeah, if anybody has any questions or anything like that, we can definitely do that.
Oh. Well, thank you. Thank you for those presentations. Oops, it's not even working. Is it? Oh, thank you. There we go. Okay. All right, here's a question for y'all. I've heard that up to 80% of rural hospitals may be forced to close due to the cuts of the Trump big ugly bill. Is this true?
Yeah, I don't know the exact percentage, but I know that currently about 700 rural hospitals are in danger of closing. There's a couple that have already closed. One of them up in Glenn County, California, this is part of the thing I was talking about earlier with critical access status. This hospital has had critical access status for like 30 years, like since the program started. And the definition of critical access status is like that it has to be, I think it's 35 miles from the next hospital. And it is 35 miles from the next hospital if you go on like actual roads the way that everybody would go. But the current administration decided, well, actually, but if you go down this little dirt road over here, it's actually only 32 miles. It's like, yeah, but nobody in an ambulance is gonna, take this bumpy dirt road to get to the hospital. But they cut the hospital's critical access status because technically it's not 35 miles from the next facility. So there's things like that happening all over the place. I know it's about 700 hospitals that are under threat. So I believe the 80% number, but I don't know off the top of my head. Yeah, if any of you guys know the 450 Sutter Medical Building, we're in there on the 18th floor. The building has been a supporter of the work we're doing for like 20 years and gives us a little bit of a discount. Otherwise, we would be able to afford, downtown San Francisco market rent. But we're also currently working on actually purchasing a new office in the Mission District, because currently our office is about 200 square feet and we have definitely outgrown it. We often have, 15, 20 volunteers in the office, and we're spilling out into the hallway and setting up the folding chairs and busting out the table, extra tables. Luckily, most of the doctors on our floor don't work on the weekends, so we can kind of take over the whole floor. But during the week we're jammed up in our little office, so we're working on getting a new office in the Mission District.
Okay, so I have a few more questions here, and there'll probably be more coming. This person wrote, to get a cancer screening, a person has to prove that they already have cancer. What can we do to change this?
Mm.
Is that true? I mean, that seems incredible, but that's what.
Yeah, I don't know about that. I assume it means like before the recommended age would be my assumption, right? If you want to get it like earlier than they generally recommend, but I'm not sure.
Do you want to come up here, Meg? Because it was your question. So,
Well, I'll say this for the first time publicly at all. I'm 88 years old. I tried to get a cancer screening at UCSF and other places. The insurance will not pay for it unless I prove I already have it.
Wow.
Now, that's not good medicine. That's dangerous. And that means that I can't get treatment or figure out what my choices are and what I want to do because I can't get a screening early enough. I am going to get a screening through a not FHDA approved system. The company is in Santa Clara. The research on it is incredible, and they actually do early screening before one may even have it, and they can detect where it is beginning. So I have applied for that through my primary care doctor, who just put the reason is undifferentiated weight loss, because everybody puts that when they can't put anything else, right, Hillary? Undifferentiated weight loss. Okay, so that's my situation. And I know of a lot of other situations. That is the reality.
Yeah. That's pretty crazy. I haven't heard that particular story before, but unfortunately, it's not that shocking, given all the stuff we've seen with the insurance companies, they basically are looking for any excuse to not have to shell out payment for care, right? That ultimately is what they're doing. Like some insurance companies deny up to half of all claims. Currently they're trying to see if they can start getting AI to deny people's Medicare and stuff like that. They're looking into that. So again, it's all about serving the bottom line, and ultimately what it'll come down to, and our ultimate goal through organizing doctors is to build a force that is strong enough to change those larger policies and actually make the healthcare system about patient care rather than about profit. Doctors have to be obviously an integral part of that because they're the ones, doing a lot of the, you know, treatment and prescriptions and treatment plans and surgeries and all the different things that go into that. And so, ultimately, I think that's what it'll take to change that situation, is making it so that these insurance companies can't, put their bottom line ahead of people's lives, potential life-threatening illnesses and stuff like that. Yeah.
Okay, well, here's another question, more particular question. Do you recommend staying with Medicare A and B rather than going to, for example, Kaiser Permanente or something similar? And then there's a question right after that, which is where is the corruption? You sort of already spoke to that to some degree, but I'm sure that's a long conversation.
You take that one, Dr. Reddy?
I could maybe take a stab at the Medicare question. So, I'm not a big fan of Medicare Advantage. Even though they say you'll get certain types of screenings and they'll lower costs, a lot of hospitals and healthcare systems are not taking Medicare Advantage anymore. So, Medicare A and B are just part of regular Medicare, so that's fine. But if somebody's trying to convince you to join Medicare Advantage, I would advise against that. Yeah. Um, and a lot of these folks, so if you have Medicare, you could also go to Kaiser hospitals as well. So Kaiser does sell a Medicare Advantage plan, which I would also recommend against. Yeah. Medicare Advantage is not good. Yeah.
Yeah.
Yeah. So, Kaiser is a good healthcare system. And if you're getting, if you're employed, if you have healthcare through Kaiser through your employee, that's good. But if they're selling you specifically a Kaiser Medicare Advantage plan, I would not take that plan. But so I would just stay with regular Medicare. And then if you have something wrong, you could go to Kaiser and Medicare will pay for it. The government will pay for that. But do not take Kaiser's Medicare Advantage plan. Yeah, so Medicare Advantage is a system that was created back in like 2014, 2015. So it's a way, so the government pays private insurance companies to then provide healthcare to patients. So it's a middleman. Medicare Advantage is a middleman. So these insurance companies said, oh, we could make your healthcare, we could lower healthcare costs if you give us money, and then we can use that money to in a more efficient way than the government does. But in reality, what's happening is they're actually giving people less care and then upcharging for it. And what we're seeing is Medicare Advantage, which is pretty much private insurance that is paid for by the government, is driving up healthcare costs, and it is not actually providing patients with good medical care. That's what the data is showing over the last couple of years.
Yeah, because if you think about it, right, the government gives these Medicare Advantage insurance companies basically a lump sum. Says here, this is the money that you're going to use to give Medicare to this person, right? So the insurance company's incentive is to pay out as little of that lump sum as possible for your care because then they get to keep the rest.
Does that make sense? Hmm.
Me, it works very, very well.
Mm.
I'm relatively healthy though. My understanding is that people who really have problematic conditions do not have the help that you might be able to get through Medicare straight on
Yeah.
versus Medicare Advantage. So, but yeah, to me, it's a system which is, why, um,
No, I think that's valid. I think it definitely worked for some people. But yeah. Oh, no, it was just should you get Medicare Advantage or regular or stay with regular Medicare? Um,
you spoke about the differences for Kaiser,
Mhm.
but you didn't speak about the differences for patients. In using Medicare Advantage maybe you did. I mean, they're getting less care, but I don't feel I'm getting, maybe I have, maybe.
Yeah. No, I think so she's asking about, it seems like your experience is that you like Medicare Advantage, and it's been giving you the care that you feel like you need. Um, and I'm glad that's happening, but in the aggregate, from what we're seeing is that if you do get sicker or something does happen to you, you need maybe more advanced medical care, the insurance company might not give you that care.
The hand surgery case that Angus was speaking about
Yeah.
with the one where United Healthcare had promised to cover these surgeries and then went back on their word later and basically stuck this 87-year-old woman who needed to be able to stay independent in her house, be able to actually like use her hands and stuff like that. Without these being able to pay for these surgeries, that was United Healthcare through Medicare Advantage. And like Dr. Reddy was saying, a lot of our doctors have started refusing to take Medicare Advantage because this is such a rampant problem with these providers. I don't know as much about Kaiser specifically, but United Healthcare has definitely been a big nasty one in that particular sphere.
Yeah, I'm not saying, don't take Medicare Advantage, but be very suspicious. Got a lot more questions. Okay.
Questions here? A few more questions. Okay, so this person wrote, last week, Sutter Health sent me an elaborate, beautiful notice bragging about all the wonderful things they do and all their plans to build more beautiful places. It did seem sort of like they're targeting people with money. That was the comment. Did you want
I
to
agree.
say something about that?
Seems like you're right.
Yeah. Whenever you see hospitals and you walk into them, there's beautiful fountains and art on the wall. Like for example, you go to Cedar-Sinai in LA. You should also always be suspicious of that. Like, that is money that is not going towards patient care. Um, and yeah, yeah.
Well, okay, this is interesting. I think this is something I'd be interested in knowing more about. Please comment on the Affordable Care Act, its use, its abuse, its a relationship to profit and good care, and for the many who need care. Yeah, Affordable Care Act.
Go for that one.
Yeah, so the Affordable Care Act, obviously it is, horrifying that they're about to kick a whole bunch of people off of insurance, right? That is, very much a very large problem. The fact that premiums are probably going to double next year for a lot of people. A lot of people are able to get care through the Affordable Care Act. Now, obviously, it does have its problems. One of the things is that, when it was originally put to the people, it was like, oh, we're going to provide health care for everybody. But what the Affordable Care Act really does is it gets most people insurance. But whether that's insurance that actually covers everything or that they can actually use, and a lot of the low cost plans and stuff like that, right? You can afford to have insurance, but the deductibles are so high for a lot of people, it never actually kicks in. So they have to pay so much out of pocket before the insurance actually kicks in that they never actually get to use it, right? It's still good for them to have it, if you get into a car accident or something like that, where you're going to have like a multi-$100,000 bill or things of that nature. It's definitely, you know, a good thing to have, but it is not as good as it was originally sort of put out to the people as, because it doesn't, it doesn't provide healthcare to everybody. It provides insurance. And then that comes with all the problems that exist with insurance still, right? It's still being run through for-profit companies that have, jacked the premiums up every year, right? I mean, obviously the subsidies ending is huge, but it's also, part of the reason the costs are so high is because it is being run through private for-profit companies that get, these subsidies from the government to provide insurance to people. So there's still that particular wrinkle that comes into play. So it's better than nothing, but not as good as it could be.
Yeah.
It really depends because there's so many different levels of things that you can get, right? Oh, yes. Sorry. So she said it's catastrophic rather than preventive. And the answer is it really depends, right? Because there's so many different levels of the Affordable Care Act, right? There's the, subsidized health plans, there's the expanded Medicaid eligibility, right? So more people can now get on Medicaid, which will cover some stuff, but not others, right? There's the subsidized plans that I was talking about, right? So those, and then that depends on like what provider of, the plan you go to and how much you can afford per month. So you might be able to get some preventative visits. But the copays are really high, so some people can afford it, some can't. And so, it's a lot more complicated. But it's like I said, it's better than nothing, so it's really gonna be a problem when a lot of people lose it, but it also could be improved a lot through it, again, not being run by these for-profit companies in many instances.
Yeah. The ACA it's a really complex topic. But I think my 2 points of view on it are, it was, so also known as Obamacare, if people didn't know that. Obama really wanted a public option healthcare system, right? Which means that you can opt into the government. You could pay the government to get healthcare directly from the government. That was the impetus behind the bill. But then it pretty much got decimated by Republicans, and then they removed the public option part of the bill. I'm a big fan of universal healthcare, public option healthcare, and I wish that was in the act. But at the same time, it did expand health, insurance to a bunch of folks that didn't have insurance. But at the same time, so now that more people had insurance in 2014, hospitals said, "Oh, now all these people have insurance, and now we're gonna have to take care of more people." Right? So the hospitals said, "Oh, we're gonna lose money because of this." And they went to the administration and they said, what are we going to do about all these new patients that we're going to have to see now? And the administration said, we'll give you guys, tax breaks. We'll give you guys some some subsidies so you could take care of this new influx of these new, 40, 50 million now insured patients in this country. And while I think that was done in good faith, what has happened now is because of that, we are seeing this huge, pretty much conglomeration and monopolization of the healthcare system by these big hospital systems. So it's almost impossible now to have a private practice because you're competing against something like Sutter or Kaiser or even UCSF and Stanford. And more we're seeing these small hospitals in the community be taken over by these huge healthcare corporations, and we're losing that kind of ground level understanding of that specific population, let's say in Daly City or in Eureka, and you're having these big corporations coming in now and pretty much putting their metrics and their protocols into these like complex systems. So that's another kind of inadvertent effect of Obamacare,
You know,
but done in good faith.
one other one is that a lot of the hospitals and local governments and stuff like that said, "Oh, well, everybody has insurance now," and so they killed a lot of the like funds that would go to charity care for people that don't have insurance because they say, "Oh, everybody has insurance now," but it's like, okay, hold on, that insurance doesn't cover everything. There are still people that are uninsured, right? There are still people that can't get as much access to care, and so losing those funds has also been a problem that has come out of that. Like kind of like what Dr. Reddy was saying with the hospitals and stuff like that.
All right. Here's a question that sort of deals with the stuff that you guys are dealing with now, but maybe a little more comprehensive. I don't know. Why do so many people call our healthcare a system? It's a patchwork of entities. So I think that's probably a question a lot of us, most of us, everybody has. And I guess an adjunct to that is what's keeping a rational, health system from actually being implemented?
Yeah, I think that's actually a great point. We are not a healthcare system. I think the only real healthcare system in this country is the VA. It's actually I think it's, yeah, after the NHS, I think it's definitely the largest integrated healthcare system in the country, right? There's 140 hospitals across the United States. Um, and so, that's why I am specifically a VA doctor, because I think the VA is a model for how we can have universal healthcare in this country. Um, it is funded by Congress. You have one decision-making authority that then kind of determines all the protocols in the hospitals. The VA was also established not to make money, but to help veterans, and it's really good at that. And what do veterans struggle with, right? Chronic medical conditions, homelessness, and drug abuse. And the VA is incredible at taking care of those three things. Um, and if you have a stroke or you have a heart attack, that's why all VAs are associated with academic facilities like UCSF or Stanford, because that's where, that kind of high tech frontline care is given. But if you're talking about chronic medical conditions and all these problems that veterans struggle with, the VA is an incredible healthcare system. And this administration and prior Republican administrations have tried to destroy the VA. It's actually been a coordinated effort by specifically the Koch brothers. They actually, it's kind of interesting, there was a young a young military officer at Princeton who started this organization that was called Soldiers for Veterans. I can't exactly remember what it was called, which was funded by the Koch brothers. And they pretty much created um, this this problem where they said all these VAs are taking way too long to see patients. So if I put a referral in for a neurologist, it might take 30 or 40 days to see a VA doctor. Or even if you go to the ED, you might wait, 2 or 3 hours longer than you want to. And so they pretty much fabricated this, that the VA was not seeing patients quickly enough. And the person in charge of that organization was Pete Hegseth. And so that actually was his first role, was actually to decimate the Veterans Healthcare Administration. And then through that, now he's our, Secretary of War, I guess. But there's been a coordinated effort by certain people to destroy the VA because the VA works. Veterans love the VA. They actually get better care. If I was, an elderly person, I would want to be taking care of the VA. I work at the VA and it is incredible healthcare, but people don't hear about that. They just hear about all the problems with the VA. So that is always unfortunate. Oh, okay.
Finding that the
Oh, sure. Yeah.
camera doesn't.
Oh, okay. That's okay. I was done. Yeah. Oh, okay. Got it. Yeah. No, that was it. So I agree with whoever said we don't have a healthcare system other than the VA.
Here's this microphone. Okay, this one. All right. Do I really need a mic? Okay.
Yeah, you do.
Okay, all right. Yes. Anyway, thank you so much for coming and talking to us.
raised my children in the European system in Germany and Austria. I felt so safe. It was always okay. I never worried about my children getting sick and whether I was going to have to pay this and that. They were safe. When I came to the United States, I did not feel safe. So that's my first question is, I think there has been an attempt in various administrations to look at the European system, which works. I know people say, "Oh, it's getting bad now," but it works, and try to use that as a template for our own system. But because even the bishop, I think it's the bishop system, which is where you take all these independent organizations, independent healthcare systems, and you make it a single fee and everybody's equal. I don't know. I mean, I've studied this a bit, but not because I kind of gave up. It wasn't going to work. And the other question is, you've mentioned Advantage. I was the one who asked the question about, should I just stay with regular Medicare or should I get Advantage? But there's also, people recommend supplementary care. That's Blue Cross Blue Shield, but also United, which the only time you mentioned it was they wound up with United's Advantage system. So I'm totally confused. Is that a good enough question?
Yeah.
Okay, thank you.
Yeah, Sid, maybe Sid. I'm not. Okay, you could go for it, Sid. Yeah.
Okay.
Yeah.
Okay,
Sure.
Sorry.
Thanks.
I actually don't know as much about the supplementals. I know that it is like, yeah, it's good to have, right? It's never a bad thing to have more coverage. Now then it comes to, oh, can you afford that extra coverage and stuff like that? If you can, it's certainly helpful to have it for any of the things that regular Medicare doesn't cover you for, and bring down your costs if you do have big expensive treatments or things like that. But definitely I would, if you were going for one of them, I would say Medicare and a supplemental if you can afford it over the Advantage plans, because again, that just gives them the incentive to give you less care because they get a set budget from the government basically that they get to keep all the extras from. But yeah, I'm not as familiar with too many of the supplementals. We haven't had a lot of cases where we're fighting the supplementals. I think mostly because, yeah, between the two, you get fairly good coverage. But yeah.
Yeah, I wouldn't add any more to that. I think, yeah, it's a pretty, no, yeah. Yeah, just my broad stroke is that I've always had trouble getting people care through Medicare Advantage. That's all I can really speak to. Yeah.
Well, this seems like a little bit of a repeat of question, but it is one that I think we all have on our minds, and so you may want to comment on this one as well. What do you think is the solution to our fragmented patchwork health system, so-called health system?
Yeah. I think ultimately the solution is, bringing together all the different people that actually make the healthcare system function, right? Like I kind of said earlier, this is part of why we focus on doctors, because there's kind of this hole in the like organizing of medical professionals, right? Nurses have super strong unions. I mean, I'm sure you guys see the nurses unions down at Kaiser and everything. They're striking all the time, getting their people together. Service workers, we work a lot with like SEIU and yeah, CNA and what's the other nurses union? I guess it's SEIU as well. But we work a lot with these different groups, and they have pretty strong organizations. But doctors are kind of lacking in that sphere. A lot of them aren't able to unionize in the traditional sense, and so bringing all these different groups that actually make the healthcare system function together and demanding a system that will actually take care of the patients, because ultimately we got the numbers on them, right? The healthcare system can't run without doctors and nurses and technicians and all these different people. It can probably run without the CEOs. It's still not 100% clear to me what a CEO does, right? But like, they're not providing care to people, right? And like all these different systems that people have brought up, in other countries, they don't have CEOs because they're not running it for profit, right? And so getting rid of these people that are setting the policies that are making care worse for people, and then also benefiting from it because they're getting the money into their pockets. So that's, that's why we organize doctors, and yeah, the ultimate goal will be to bring all these different groups together and demand that change in the healthcare system on a much larger scale, and actually build a real healthcare system that is a system rather than this patchwork. Doing that.
Yeah, a couple of brief words about that. If I had to choose the best healthcare system in the world, it'd probably be Germany or Australia. So everybody in those countries, they all get universal coverage for basic needs like primary care and certain medications and ED visits. Doesn't matter, if you're rich or poor. But then let's say if you are rich or middle class, you can then buy supplementary insurance that can provide you with, more boutique care. If you want to see an orthopedic surgeon a little more quicker than you would with the regular universal health coverage. I spent 4 months at Oxford in medical school, where I was able to work at the John Radcliffe Hospital. And, I think we're given a lot of propaganda in the States about how terrible universal healthcare is, but people over there love the NHS. There was a survey released at that time that asked, what are you most proud about being British? Number one was the Queen. Number two was the NHS. And so even though we're told here that it's being decimated or it's terrible, they love their healthcare system. So that's something to be aware of. And I don't know if we're going to ever have universal healthcare in this country. I think the next best option would be a public option health insurance company or health insurance system where folks can opt into the government or pay the government based on some kind of tax bracket. Sorry, they could pay the government for healthcare. That is not like too expensive. So I think we could have public option in this country, and I think the states need to start it. I think what we're seeing is that the states are where the experiments are happening. So if California can have a public option health insurance company and show a proof of concept, then that could be expanded to the rest of the country. So that's one of my goals too. And POC isn't overtly political. I think there's we don't really support candidates or support specific parties. It's more about just helping physicians and healthcare providers on the ground level. So yeah.
Well, I want to make one slight correction. It's ultimately very political to fight for better healthcare. We're not specifically partisan in that. Yeah, we don't deal with candidates or things like that because unfortunately they still have to run for office and get the donations and stuff like that. So they often skew a lot more toward these big companies that can help out their campaigns. There's obviously some exceptions, but ultimately we found it's not the most effective in the long run. We like to do the more grassroots approach, organizing on the ground level and doing the day-to-day advocacy and the arm's length organizing and all that stuff.
Well, I just want to make one comment. I don't know if people here have read the book or heard about the book, The Sum of Us by Heather McGhee. Have you ever heard of this? Anybody? Her book, it really talks about racial politics in the United States and why the US is so dysfunctional, not just in healthcare, in education, housing, and you just name it. And a lot of it has to do with the racial politics in this country, which we all know is sort of how this country came to be. So anyway, it's one book I think that really explains a lot. But anyway, I appreciate you guys being here, all of you being here. If there's any last questions that people want to ask, please do so. Otherwise, we'll close this out. And I want to give everyone, a round of applause.
One final thing real quick.
Sure. Okay.
Just real quick. The three of us will have clipboards. If anybody's interested in, volunteering and just learning a little bit more about what we do or potentially getting involved, put your name and number down. We'll give you a call.
Okay. Thank you guys again. And that's it. We'll see you all next week. Next week is the Hansel versus Gretel here at 9:30. Okay. Goodbye, everyone.